There is one operation in medical history that has become a legend of horror. Not because it failed once, not because it killed one patient, but because it killed three. A single operation with a death rate not of 50%, not 100%, but 300%. The man behind it was Robert Liston, nicknamed the fastest knife in the West End. He was celebrated not for saving lives, but for how quickly he could cut. In an age with no anesthesia, speed was survival. Every second of pain was another heartbeat lost, another drop of blood spilled. And so speed became God, and Liston was its prophet. Crowds came to watch him. Surgery was not quiet science, it was theater. The smell of blood filled the room, sawdust scattered on the floors to catch it. Students leaned forward, notebooks in hand. Assistants pinned men down as they writhed. And high above, ordinary citizens stared, craving both spectacle and salvation. On one infamous day, a man's leg was to be removed, but in his furious speed, Liston went too far. The first slash cut not only the patient's limb, but also severed his testicle. His next strike sliced through his assistant's fingers, and in the gallery, one spectator collapsed in terror, his heart giving out on the spot. Within days, all three were dead. The patient bled to death, the assistant died of infection, the spectator was already buried. One operation, 3 coffins. The only surgery in history with a 300% mortality rate. And it was no mere accident. It was the symptom of a darker truth. In this age, the men trusted with the knife were not doctors at all, but barbers. Long before Liston, the knife was not in the hands of doctors. It belonged to the church. Monks and priests once wielded the scalpel, stitching wounds and draining blood in dim candlelight. Their hands were seen as holy, their cuts guided by faith. But in the 12th century, Rome spoke. The church declared it unholy for priests to shed blood. With one decree, healers across Europe dropped their knives. Wounds did not wait. Bones still broke, soldiers still bled, but the priests could not cut. So who would take up the blade? The scholars who wrote books of theory refused. The nobles kept their hands clean. The answer came from the streets. Men already skilled with razors, already trusted to cut skin without hesitation. The barbers. Suddenly, barbershops became more than places of grooming. They were hospitals of last resort. In the same chair where a man might have his beard trimmed, another would have his arm opened, or a tooth ripped from his skull. Necessity had created something strange. The barber-surgeon. A figure both ordinary and terrifying. A man who could cut your hair in the morning and your leg in the afternoon. From faith to razor, the knife had found a new home. The barber was no scholar. He did not study anatomy in great halls, but he had something far more valuable to the wounded: speed and steadiness. With no chloroform and no anesthesia, surgery was a race against time. The longer the cut, the closer death came. A slower hand meant agony, blood loss, infection. But a barber's razor moved quickly. That was enough. Inside these makeshift barber hospitals, men screamed as teeth were yanked out by iron pliers. Soldiers thrashed as legs were cut with saws. Patients were held down by friends, by neighbors, by strangers, while the barber carved as fast as his arm allowed. The barber became the people's surgeon not because he was trusted, but because he was all they had. Better the quick slice of a razor than the slow fumbling of a doctor who wrote about humors but never cut flesh. In this grim bargain, steel mattered more than science. Those who survived praised the barber's hand. Those who did not had no voice. It was brutal democracy. The fastest blade was the best. And so, Over centuries, the barber's role grew larger, their shops multiplying, their reputations hardening into something both feared and respected. Thus, a strange new figure was born in European society, part groomer, part healer, part executioner. A man who shaved your beard at dawn, pulled your tooth at noon, and amputated your leg before nightfall. The barber-surgeon was here to stay. By the 19th century, one name stood above all others in this bloody art: Robert Liston. He was tall, broad-shouldered, a surgeon of immense confidence. His reputation was carved from speed. He could remove a limb in less than 30 seconds. In a time before anesthesia, that speed meant everything. For some, he was a savior. For others, a butcher. His operations became public theater. Crowds filled the surgical galleries, climbing benches to watch the fastest knife in London. Students scribbled notes, gentlemen watched with morbid curiosity, and patients were strapped down, wide-eyed with terror, knowing every cut would come without mercy, but also without delay. But on one infamous day, speed betrayed him. A patient lay ready for amputation. Liston lunged forward, his knife flashing. In a single stroke, he not only cut the leg, but also slashed through the man's testicle. In the frenzy, his next strike sliced off his assistant's fingers. Above, a man in the gallery reeled, his heart failing from shock. The patient died soon after, his body unable to endure the bleeding. The assistant, his wound festering, succumbs to infection days later, and the spectator never even left the theater alive. 3 bodies, 1 surgery. A result so grotesque, it passed into legend. The only recorded operation with a 300% death rate. Liston's tragedy was not just a single man's mistake. It was a mirror of the age. Medicine was still a blade-driven gamble, a world where skill with steel outweighed knowledge of the body. And in that world, the barber-surgeon and the speed surgeon were 2 sides of the same bloody coin. Step outside any barber shop today, and you'll see it. The striped pole, red, white, and sometimes blue. Most think of it as decoration, but its roots are soaked in blood. In the Middle Ages, patients clutched the pole to steady themselves as their veins were cut and drained. The cloths used to bandage wounds were hung to dry outside, twisting in the wind, wrapping around the pole itself. The red came to symbolize blood. The white stood for bandages. Together, the spiral told a story of pain and healing, or of death disguised as care. When barbers hung their cloths, they were not signaling style. They were advertising surgery. In time, America added a 3rd color. Blue was introduced to evoke the nation's flag. But its true meaning has long been forgotten. What people pass every day is not a symbol of patriotism. It is the fossil of a darker era. A reminder that once, the barber's chair was also the surgeon's table. To the villagers who walked the streets of medieval Europe, the pole was no decoration. It was a promise, or a warning. Here your beard may be cut. Here your blood may be spilled. That pole remains today, stripped of its true meaning. Most who see it think only of grooming. But in truth, every rotation of red and white is a spiral back through time, to an age when a razor was a scalpel and a barber was your only hope. The barber-surgeons did not remain scattered. They organized. By the 14th century, in London and beyond, they formed powerful guilds. The most famous was the Company of Barber-Surgeons. Under its banner, men with razors and saws stood shoulder to shoulder, united by steel, bound by blood. It was a strange alliance. Men who shaved faces, standing equal with those who amputated arms. Hair and flesh styling and surgery placed into one trade. To the outside world, they were one and the same. But as the centuries passed, knowledge grew. True physicians, men of universities and books, began to see surgery as beneath them, tainted by the blood of barbers. They longed to separate. They longed for respect. In 1745, the break came. Surgeons declared independence, forming their own guild, abandoning the barbers forever. What had been one brotherhood split in two, the surgeons rising into medicine, the barbers sinking back into mere grooming. That divide worked. In time, surgeons became respected, their craft elevated to true science. But the stain of the razor never fully left them. The ghost of the barber followed every surgeon's hand, whispering that medicine's roots were once drenched in hair, blood, and bandages. Even now, traces of this strange past remain. In some countries, tattoo artists are still legally bound to barber guilds, as though the medieval link between blade, ink, and skin could never be severed. It sounds absurd. A man who inks dragons onto shoulders belonging to the same institution that once cut open arms for bloodletting. But history is sticky. Once institutions form, they cling. And so the barber's shadow stretches even into the 21st century. Barbers themselves became ordinary again, men of mirrors, combs, and scissors. Yet their shops still hold ghosts. That striped pole outside is not decoration. It is a remnant of the time when stepping inside meant risking your blood, your pain, even your life. The line between barber and surgeon was once blurred beyond recognition. To cut hair and to cut flesh were treated as the same skill. That absurdity feels distant now, but it shaped centuries of medicine. And perhaps that is the lesson, that progress is not always neat. It is born in confusion, in mistakes, in hands that were trusted not because they should be, but because no one else would take the knife. Today, medicine appears unstoppable. We live in the age of machines that scan the body, of surgeons who cut with lasers, of drugs that numb pain. And yet, in one sense, medicine now grows slower than ever. For centuries, progress was driven by brutality. Experiments on prisoners, operations without consent, testing on the desperate, the poor, the powerless. It was horrific, but it pushed medicine forward. Now ethics and law forbid such acts. We celebrate that as progress. But it also means medicine advances more cautiously. Some predict that in 50 years, even animal testing will vanish. And when it does, progress may stall entirely. We may soon live in an age where breakthroughs are strangled by morality, where the blade is sheathed not because it cannot cut, but because we choose not to let it. The very same debate that once silenced monks may silence us again. From the bloody hands of monks to the razors of barbers to the speed of Liston's knife, medicine has always lived in tension between cruelty and compassion. Perhaps the final question is this: when the scalpels go silent, who will cut to save us?